Welcome back to my channel. Today I'm going to discuss a subject I'm very passionate about, male facelifting and how it differs from female facelifting. Now, there isn't a lot of great content out there for the public to understand this subject. I'm going to try to simplify it for you. So if you're considering having a facelift, or your spouse or your family member, I'm going to give you the information that you're going to need to make informed decisions. So I'm going to break it down by first discussing the anatomic facial differences between men and women, why men age, what accelerates the aging process, and the benefits of having a male facelift. So the anatomic differences between a man and a woman are essential when analyzing their face. What is the difference between a man and a woman that we associate with masculinity or femininity? The first thing I look at is the outline or the contour of their face. After the age of 40, most men have what I call a squared off or rectangular outline to their contour of their face. Now, there is differences between different ethnicities, different races, and so forth. So I'm just talking in general terms here. There's always exceptions. There's other anatomic differences that we immediately associate with masculinity. One of them is a low brow, what I call a straight brow position, or a T. I call it a T with the line going down the nose across the brow. That is typically associated with a male. Women obviously have an arch to their brow. The second thing is their brow may be more prominent. The bones around their brow may be prominent. The bones around their cheeks may be more prominent as well. Their jawline is more prominent because the jawline and their bone down here is more prominent. So all these things speak for a masculine appearance. And it is critical that the plastic surgeon who is considering doing a facelift on you is thinking about the anatomic differences between a man and a woman. I have seen plastic surgeons who do many facelifts on women apply the same principles to a man. And when they do that, they end up feminizing the appearance of the male, okay? And you don't want to do that because that is something that can't easily be reversed. So it's critical that whoever is analyzing your face and is considering operating on you needs to look at you like a different entity compared to a female in order to achieve natural looking results. So I'm going to just take you through the evolution of Arnold Schwarzenegger, who I'm sure you all know was the weightlifter, governor, actor, etc., and how his face changed over time. Of course, he's Caucasian, he's European, so there are differences, again, between ethnicities and races, but I'm going to use him as an example. So if we look back at his early pictures, and when he was probably in his 20s, you can see that the facial outline of his contour of his face is more oval. And that is very typical. In the beginning, when we're young, men or women, they all have this oval appearance. Yeah, there may be a little more prominence of their jawline again and their other bones, but in general, they have more of an oval contour to their face. As we see him reaching middle age, however, we start to see that he starts to lose facial fat. Men and women can lose facial fat in their middle years, and then as he ages forward, you start to see more prominence of the jawline, laxity of the skin, and changes around his whole face, which imply that the contour of his face is now becoming squarer in shape. And this is all very typical of the evolution of the aging process of the male face. Our face ages for many different reasons, and some people will get accelerated aging if they are smokers, if they drink a lot, if they have a lot of sun exposure, and of course, genetics plays an important role in terms of the degree of aging that someone experiences. So aging is a part of life. Everybody knows that. It's an obvious. But smoking, alcohol, sitting in the sun and frying your skin, those things are going to obviously accelerate the aging process and make you look worse before your time. Genetics obviously are something we can't control, and we're all going to age. And what's exactly happening with the aging process? Okay, so it's quite complex. I'm going to try to simplify it. Basically, there's a loss of collagen and elastin in our skin. Our skin doesn't bounce back; it loses its tonicity. There's weakness of the deeper fascial planes, these little fibers and fascia underneath the skin that keep everything suspended upward. and sometimes backward. So around the eyes, for instance, there's bulging fat, and some of that fat is kind of falling forward because it normally would be suspended upward, and now it's kind of by gravity coming forward. There's also changes in muscle tone, and believe it or not, the bones themselves can change with time. So there's been studies to show that the jawbone, for instance, gets bigger with time. So all these things occur. And the real solution to really lifting the face, I mean, we can look in the mirror and we can kind of see what we would potentially look like by lifting it up physically. But the only way to really physically lift it up is really to do a male facelift. It's not these over-the-counter remedies or even microneedling or any of the other energy-based devices really can't shift and lift like it should, and neither can injectables. And there are injectable products that are claimed to lift their face, but really they don't really lift well. It really requires surgery to do that. So when a male patient consults me regarding whether or not they need a facelift or how to do the facelift or what extent of a facelift they need, I first look at three real components of their face. The first thing I look at is their neck. I want to see how much laxity there is in the neck. Is there muscles lax down here? Is there just skin laxity? Is there bulging glands down here? Are there bulging muscles down here? All of those components may have to be modified in the central neck by making an incision down here. And sometimes just operating down here alone can allow the skin to redrape in this area without making any additional incisions around the ear. Now, sometimes you need to do additional steps of elevating the skin as well. So in those cases, you have to make an incision down here. The neck is always important and primary, but around the ear, the incisions also may have to be made. And the extent of those incisions also depend upon the laxity of the tissue. So in men, it is critically important that the design of the outline incision is well thought out in advance. Why? Because the beard is advanced backward, okay? And as we advance this skin backward, we're going to now juxtapose this beard near the earlobe and near these other structures around the ear. And that textural difference could be a giveaway that there's been a facelift. So in particular, around the earlobe here, there has to be a little cuff of normal skin left at the time of the initial incision. Of course, the incision goes behind the ear and is hidden way up into the hairline so that you don't see the incision from the front or even from the back. It can be well camouflaged in the hairline. But in the front, we don't want to advance this beard too close to the earlobe because of the textural difference, and we don't want hair follicles right up against the earlobe because it looks unnatural. However, around this little structure called the tragus, we don't have really much of an option. We still have to advance this over the tragus this way. So some of the hair follicles underneath this little piece of skin can either be removed at the time of surgery, and if there's still some remaining hair follicles there, then we do electrolysis or laser hair removal to remove these hair follicles so they're not right sitting over the tragus. Around the sideburn, the incision also has to come forward in a very squared-off way, so to preserve this geometric dimension of the sideburn. So these things have to be thought out in advance because we don't want to have stigmata of having a facelift after surgery, which men detest. They don't like to have anything that speaks of having a facelift. It's less acceptable for men to have facelifts than women. Women will tolerate the signs of having a facelift more than men. There are really many different approaches to tightening the face, however, not just raising the skin, but actually tightening the deeper layers of the face. Something called a SMAS layer has to be tightened, and it could be either a high SMAS or low SMAS. It could be a deep plane facelift. All these types of approaches can be applied specifically to a specific scenario in which people have either less or more laxity of the face. And man, it's a little less important to worry about whether or not they're going to have a deep plane or a superficial plane facelift. The real focus on men is their jawline, their neck, and so forth. That's what they're most concerned about, and not so much about their face. In addition, there can be facial volume loss, however, and that facial volume loss may require fat grafting to their face. That's not uncommon, and we see as we age, we see this mid-face atrophy of the fat, and sometimes this fat has to be augmented by taking fat from our bellies or our hip and centrifuging the fat and spinning it down to get purified fat, and then re-injecting some of this fat into our face to replenish the volume loss in our face. One cautionary note regarding male facelifting is that we have a greater tendency to bleed because our skin is thicker. It is imperative that the blood pressure of a male is well maintained before surgery, intraoperatively, and postoperatively. We don't want to see any elevations in blood pressure because that can lead to what's called hematomas, which is a collection of blood under the skin. We want to avoid those complications, and that can be avoided by controlling the blood pressure. So we've covered a broad range of issues that have to do with male facelifting. I've been doing this procedure for over 30 years, and if you have any further questions, please leave them below. I'm happy to answer your questions. Please subscribe to my channel, and I look forward to seeing you in my next video.